Okay, so the question is an 18-year-old high school student has presented with bloody stool, abdominal pain, low-grade fever. Her symptoms resolved spontaneously after 5 days. Most likely cause of bloody stool and abdominal pain along with fever is acute gastroenteritis. In acute gastroenteritis, these three parameters are present in bloody stool, abdominal pain, and fever. Male absorption syndrome does not present like this. In ulcerative colitis, patient complains of different uh, complaints, and pseudomembrane colitis presents with different complaints. A 40-year-old lady present with 3-month history of backache, difficulty in managing stairs. Investigation shows low calcium and raised alkaline phosphate level. Most likely diagnosis in her is inflammatory polyneuropathy or osteomalacia. Osteomalacia is there. Now osteomalacia, for understanding osteomalacia, we have to look at the age. It occurs most commonly in female who are menopause, and elder women like 40 years of their age. They have difficulty and they have low calcium because they have osteomalacia. So in osteomalacia, most commonly it occurs in women, and after menopause it occurs on osteoporosis is not present in this. Okay, so another question is a 42-year-old man was diagnosed having enteric fever. The drug of choice for enteric fever will be not chloramphenicol, it will be ciprofloxacin will be drug of choice for enteric fever. Ciprofloxacin is treatment of choice. A 75-year-old lady present an emergency with painful hip joint after slip from bathroom. Patient is having advanced dementia with little discomfort. On X-ray, there is grade 1 fracture. A femoral head is tilted slightly, and valgus is impacted on femoral neck stump. The trabeculae are aligned. What is the best treatment option for this patient? Extensor flexor application will not be there. Non-operative management is the treatment of choice for this patient. Okay, so the question is a 16-year-old boy was admitted with 3 days of the history of low appetite, vomiting, yellow discoloration of eyes, means jaundice. He was jaundiced, liver was not palpable. And evening he became confused and voiding in bed. Lab test will be a best indicator for prognosis of this boy will be lab test will be AST. No, AST will not be performed. Albumin is not performed. Bilirubin cannot be performed. The answer will be PT and INR will be performed because patient is has affected liver, so PT INR should be performed. Now another question is a 28-year-old male patient present in the emergency with road traffic accident. On neurological examination, eyes are open, withdrawn extremity, response on painful stimuli, make incomprehensible sound. The GCS score will be the GCS score will be 9 for this patient. So GCS score is measured by verbal, visual, motor, and auditory responses. So in this way, GCS score can be measured. A child has acute respiratory infection. On physical examination, you will find mediastinum is shifted to the opposite side, reduce chest movement, and reduce vocal parameters. Stenoidal percussion is there. What will be diagnosis? Now, in order to understand this question, we will have to look at the diagram. Let's suppose this is lung, right side and left side of the lung, and patient has stenoidal percussion. Stenoidal percussion is indicative of pleural effusion with reduced expansion of the chest, and in pleural effusion, trachea is shifted opposite to the affected lung. So this is the clear demarcation of the pleural effusion.